This was a company we started back in 2013. It was just a group of physicians wanting to do good care for patients.
The overall process for approaching a stroke patient seemed flawed to us. In other words, there was a lot of waiting for neurologists to drive between hospitals.
We thought about, well, what can we do to get that physician to bedside very quickly? And better yet, what can we do to get best stroke specialists in the nation to bedside right here seeing a patient coming to a community hospital? And that's where we thought of telemedicine.
And we just saw that as an opportunity to improve the care by speeding the delivery of life-saving medications that are needed in order to treat many stroke patients.
So now we're able to get a physician within minutes of activation to bedside, seeing that patient along with nurses and physicians on ground and helping to treat that patient very quickly.
What makes our service line different is, again, we have both the components of high level of clinical care, truly with high standards in place, in addition to an efficient and reliable infrastructure of a telestroke service.
A large difference between our physicians and physicians of our competitors is that we participate in every aspect, from the evaluation to the exam, to the ordering of the medication, to the follow-up of the patient. There are several factors, obviously, that we look at in determining a high-quality physician. One of the main things is their prior experience. So when we hire physicians, we want to make sure that they have experience and comfort in treating acute stroke patients.
Having a strong clinical acumen in general, caring about quality of care, and being familiar with the technology and being comfortable with technology in general.
So here at TeleSpecialists, we're looking for physicians who are eager and interested to participate in telemedicine. It's a wonderful opportunity to join a practice that is already operationalized.
So what is it like to be on a TeleStroke shift? That really depends on the day, but in general, when we get a phone call saying that there is a TeleStroke alert that we need to attend to, we look and see what hospital it's coming from, what state it's coming from, and then from there, it pretty much follows a very standard procedure. We examine the patient right where the emergency crew is bringing them in. We're working with the nurses and the emergency room doctor. After we do our exam, we sometimes talk with the emergency room doctor right there across the screen. Patient goes for CT, and then we're talking with family, making phone calls if we need to, looking at the electronic medical record, looking through the patient's medications. Has this happened before? Trying to get all the details together that may not be present right when that patient comes in. And then following imaging, we're making the big decisions if this is a large vessel occlusion. Do we need to call a neurointerventionalist? Do we need to speak with a neurosurgeon? We're constantly in communication with the neuroradiologist, the emergency room doctor, the patient, and the family all at the same time. And this all happens in a very organized manner.
Any physician who is interested in potentially exploring a career in telemedicine to look at TeleSpecialists from the perspective of an in-person physician. You are a physician practicing with TeleSpecialists is experiencing all the benefits of working from home, being able to live where they like, to practice where they like, while at the same time participating in a program that is as close as one could possibly be to practicing in person on the ground.
I think TeleSpecialists is very good for maintaining a work-life balance because you're able to choose how many shifts within a range that you would like to do. Personally, I'm full-time, so I do about 15 to 16 shifts a month, whereas I kind of felt in the community as a private neurologist, but also doing some hospital work, that I was never done with what I had to do. It was always, some other patient phone call or some other tasks that I had to do that was on my list. So here I feel like there's even more of a balance because there's this bigger separation between when I'm at work and when I'm not at work.
Having young children just coming out of training, I had this ideal of what being a doctor, being a neurologist was going to be. And when you get in the trenches of a traditional neurologic practice, it just doesn't fit the bill. And I ended up becoming very burnt out. So when I found teleneurology with TeleSpecialists, it really just turned everything around. I was able to take care of myself on my off days because when you're off, you're off. You're not having to field phone calls or do some of the administrative stuff that you do have to do when you have your own practice.
So what I like about working for TeleSpecialists is that you can concentrate all your time caring for that patient at that given time, and then you don't have to worry about dealing with insurance companies, dealing with prior authorizations. But the other part that I feel is very important is providing care to patients that don't have access to neurologists in smaller hospitals, in smaller cities.
You're on shift with about 20 other physicians. We have constant shift chats going. Your technical questions, you're a new attending and you have questions about clinical care. We review cases, we discuss things, and everybody really is great at supporting each other and answering questions. So as far as on-shift support, you have a level of that you will never have in practice, because you're never going to have a bunch of other neurologists sitting around ready to answer your questions.
My favorite thing about working for TeleSpecialists is flexibility. Flexibility and also growth. I think TeleSpecialists is a unique company that it offers you not only an opportunity to really be a psychiatrist, a clinician, but it really allows you to stretch your other muscles and really allow you to advance in other ways outside of typical academia, outside of this sort of academic setting.